that we have the client's consent, we can move on to the clinical tab. And when you see this in the clinical tab, the first section you're going to see is mental health screening. We're going to start with that section. Click on that. We're going to move to add a new mental health screening. But we already did this in this client, so we are going to view the mental health screening. Under this screening, it's 4 pages, and then we're going to score at the end. This purpose of this screening is to screen out any acute situations that are happening, meaning if there's anything that needs to be addressed immediately, we want to do that. After going through the assessment or the screening and finding that the client is okay to move on to the assessment, then that's what we'll do. So these are the questions that we're going to answer to make sure that we can move on to the assessment without any issues. So we're going to go through the depression scales. We're going to go through the mania scales. These are all questions that we need to know if these situations are going to prevent us from moving on with the assessment. In the comments box, say you put yes to something, such as on the depression scale, we did put yes to fatigue and loss of energy. This is a symptom that the client's experiencing, but it's not an acute situation that would prevent the client from moving on to the assessment. So we may want to put in the comments box that client has been experiencing some fatigue and loss of energy for the past couple of months, but not in any situation that would prevent them from being in a crisis situation. So always explain, it's a good idea to explain your yes answers in your comments box. So then you move on and do the mania tab or screen, and then we would move to save and move on. Page 2, we're going to go through anxiety. And again, clients can answer yes to some of these questions. We are assessing whether this is a crisis situation that needs to be addressed immediately. So they can answer yes, and I would just explain that in the comments box. And move on to the next section. Section 4 is PTSD. So we're going to talk about questions as far as are they having any problems currently with having any of these situations as far as intrusive or repeated distressing thoughts, flashbacks, things like that that are current and persistent. They could be having these experiences, and we want to identify that. And again, this is about is the situation to the point that we cannot move on with the assessment. But we do want to identify if they say yes to these so that we can know that moving forward, we want to address these things in our assessment and our treatment plans. Some of the questions that are extremely important to know right away: is there any self-harm? Are you currently having any concerns for harming yourself? Have you in the past? If they have in the past, then it's something we need to know that this has happened to them, that they have had self-injury to themselves, and so that way we want that documented. Now we're going to move on to the next. Page 3, suicidal ideations. These are questions that if they answer yes, it could prevent you from moving forward. So are you currently feeling like hurting yourself or taking your own life? If they answer yes, we want to know, how would you hurt yourself? In other words, do they have a plan? And what's the likelihood that you would do this? Again, if they're answering yes to this question, this is what's going to stop us and tell us that we need to do something right away and that we aren't able to move on to the assessment because the client is currently suicidal.
So on question 1, suicidal ideation, and question 2, homicidal ideation, these are the only 2 places that are going to give you this ability to stop this assessment immediately. I'm just going to make this a little bigger here. On this question, when you answer yes, you're going to answer the 2 sub-questions, but it's going to allow you to stop this mental health screening right here by clicking this red link. Do you want to stop the screening? If you do, you're going to stop right there. We don't need to ask the client any other questions. and that's only on question 1 and question 2. Other places where you see the blue questions, and it's listed above there, that if you answer yes to any blue question, it's going to stop when you save that page. But these 2 questions are going to allow you to stop instantly.
Okay. So the same again with the homicidal questions. Are you currently having thoughts of wanting to hurt or take someone else's life? Again, if you click yes, those questions are going to come up. Again, what is your plan and what's the likelihood? And you will have the option to stop immediately. The purpose of this is we aren't going to go on to an assessment if the client is having current suicidal or homicidal ideations. We need to address that situation right away. And again, if they do say yes, one of the things that we're going to do is we need to have a plan of action as far as what we're going to do for the client. Most likely, we may need to call 911. We may need to get this client to an emergency room. These are the acute situations that would stop us from moving forward. Another section is psychosis. These sections could also prevent you from moving forward if the client is currently in a psychotic episode. So some clients may have some of these psychosis symptoms and yet not be in an acute situation. This may be part of their mental illness, and that they use medication, and they can move on to the assessment, and that is what you're assessing. So delusional, are they, these are the questions you're going to ask. Again, maybe they'll answer yes, and I would say if they do, you need to explain the answer as far as why they answered yes and why you feel that it's okay to move on. Yes. And then we're going to go to page 4. So then we're going to look at their history of mental health. So we want to know, have they had treatment for mental health? Are they on medications? And have they ever had any other psychiatric medications other than what they've listed here? Again, put in the comments box. And this is just to get a little bit of history, because they may not currently have any symptoms, they may not currently have any issues, but if we know they have a history of it, that's something that needs to be documented. And then we're going to do a mental status exam, just about their thought process, any paranoia, are they responding to any internal stimuli, meaning are they hearing voices, and what's their speech pattern like? And these could let us know a little bit further as far as, are they having any type of current episode? Completing this, in this particular case, the client didn't have any acute symptoms, and the client was okay to move on to the assessment.
So if you had answered yes to any of those questions in blue, when you save that page, it's automatically going to bring you to this page and not allow you to continue the screening. And it's going to say that you need to make an emergency referral right now. And so you should not continue. So after we have completed a mental health screening, we're going to move over to the assessment tab. So we've clicked assessment. If you are doing a brand new assessment or an updated assessment, you simply would put the date in here, whatever day you're doing this on, and then click new assessment. If you're, in this case, in order to expedite the training here, we've actually completed one, or almost completed one, and so that's what we're seeing here. And it's showing that the interview date was on 3/5 and who the staff person was who conducted this assessment. And you'll notice that there's little sub-tabs here, some socio-demographic background and history. You'll see there's 22 questions, and we've completed 22 of those questions. So forth, and we get down to the summary level of care. It's 0 of 2. So the assessment's not completed, and we've not finalized it. We've not done a summary yet because we don't have answered those 2 questions. So on any assessment, if you want to view the details of it, over here is the view assessment. So you're simply going to click that link in order to view what's already been completed.
So then we're going to open up, and it's going to open up to our demographic and history. And this is really the start of your questions with the client. And again, at the start of the assessment, I would like you to again tell the client, just give them a little bit of background about what we're going to be doing, what the process is going to look like, and kind of prepare them for this process. And let them know that we're going to go through a series of questions, that these questions are divided up into 6 sections, and that we're trying to get a picture of what their needs are and what we can do to help them with what they can. That's the first question we really want to look at, is why are they here? This is an important question, and it's really going to establish not just for you to know what the client is coming for, but also this gives you an opportunity to start establishing a relationship with the client. So we're going to start with the very obvious question as far as what brings you here to task today. And I would suggest that you put in this box, which again, the box is not large and there is a limited amount of space, but I would put what actually is bringing the client here so we can start the picture of the client and start knowing what's happened. So for this particular client, the patient was referred by court after being arrested for public intoxication and resisting arrest. Patient states she was leaving a bar with friends and got into a fight with one of her friends, and the police were called. Patient states she was intoxicated. So she was arrested for public intoxication, she got into a fight, and there were other charges due to the argument that she's now facing. Asking basic demographic questions after that. So we could probably answer some of these questions without even asking the client, as far as needing an interpreter in English. But we do want to know some of their other demographics. We're just kind of checking to make sure that we have a correct veteran status, education. We do want to ask the questions about their gender identity. These questions are important in our demographic section. What's your official gender, meaning what was their birth certificate saying? Do you identify with this gender? Do you consider yourself transgender? And then the next one is, do you consider yourself to be heterosexual, straight, homosexual? I think there's four options there. So just to make sure that you ask if they do consider themselves to be different from the gender they were born, just make sure you ask them all these questions, because there is a difference between your sexual preference and your gender preference. Then we'll also ask, of course, just their other general questions: marital status, number of dependents, and children living in the home, if they have children under their care, or if they've lost children who were under their care. In this particular case, the client has joint custody of a young daughter who lives primarily with her. So we know now that she's living alone with her daughter and divorced. And again, too, this goes on to some more demographic and history, employment status, enrolled in school, family income, social connectedness. These are all questions that we're trying to get a picture of the client's living situation. Social connectedness has to do with, have they used any self-help, religious, or peer support in the last 30 days? And as far as in question number 22, in the last 30 days, have you had interactions with family or friends who were supportive in your recovery? That gives us an idea as to whether they have people in their lives that are supportive of this process of recovery. The client mentions that her mom is very supportive and has encouraged the client to attend treatment. So this next section is the criminal history. This has to do with obviously the criminal justice piece, what it is. This client did say she was asked by the courts to attend treatment, so we do know that she has a criminal history. Hers is current, so she's had just the number of arrests in the past 30 days has only been 1. How old were you at the time of your first arrest? She says 24, so that must be a prior because she's now 34, I think. How many times were you arrested before 18? That's asking if they've had any juvenile record. And then what was the most serious charge that she has ever been arrested for? It was driving under the influence. And what's the most serious charge you were ever convicted of? So she was convicted of that charge. Have you ever been involved in gangs? No. And then what's your most serious current pending charge? Resisting, obstruction, injury to an officer. So this has to do with her behavior, obviously, at the time. And then the charge does have to do with an alcohol charge.
Right, and one of the things I wanted to say about question 8 here is you obviously don't need to answer each one of these charges. It's whatever is appropriate to this particular case. The system is going to look for at least one to be entered in any one of those sections, whether it's alcohol and drug, property crimes, violence against property, violence against person, and so forth. So again, you don't have to complete all of those. It's just whatever is appropriate to this particular client.
Okay, and then we're just going to complete the criminal history. Dispositions and acceptability has to do with probation and task. And this client's never been on probation. Relationship between your criminal activity and your drug use. This is a directly related criminal history because it is an alcohol related charge. So now we're going to move on to their drug and alcohol history. This is an important piece, as they all are, but this one is going to give us their history. It's very important for us to get their full history of drug and alcohol use because this is going to help us understand their diagnosis.
So because we've already filled this out, we already have the substances listed here. When you're doing a brand new one, when you click on this page, page 1, it's going to be a blank page. So there'll be a small link there that says, to add drug. So don't be shocked when you look at it and there's nothing there and you're like, wait, all these fields are here. Once you click add new, then this whole top section here is going to appear with all the questions. And then it will allow you to add it to continue that history if you have more than one.
Okay, does it show primary? No, not anymore.
Not here,
okay.
It's up there.
Okay. So in my opinion, you should ask them what their primary drug of choice is first so we can get to their main drug use. In this instance, it is alcohol. So we want to start with the questions as far as when they first started. And again, what we're trying to do throughout this whole assessment is to get a picture of the client. We want to understand what brought them here this day, meaning that it starts from back to when they first started using. So in this instance, she started using at the age of 14. Her last use was just a week before coming. So she used a week ago. It goes from their first use. The next question is, when did they start using regularly? So she reports that around the age of 19, she started to use regularly 4 to 5 beers up to 3 to 6 times a week. And the reason why it increased from earlier use is because she was away at college. So when she went away to college, her use started to be pretty frequent. Her highest use is actually her current use, which is the age of 34, drinking up to 2 liters of wine up to 3 to 6 times a week. She states the reason why she's at this stage is because she's divorced, living alone, and she's drinking with her friends. Use in the last 12 months, yes. And it's the same as her highest use because it's her current use. So both her last 12 months and her last 3 months are the same. If you clicked that they haven't used in the last 12 months, which actually if we go down to cocaine, so she does state that she used cocaine in her past, but she's not current. So she used cocaine, her first use was at 21. Her last use was in 2008. She first started using at the age of 22, a couple of lines, 1 or 2 times a week. She inhaled it, and this was when she quit college and she started working at a bar. That's when she was introduced to cocaine. And that was actually her highest use. So during that period of time when she was working at a bar and waitressing, she used, and then that use stopped after that, after she changed her lifestyle. So if you look under use in the last 12 months, she says no. And so now it grays out the areas of amount, frequency, and route because they don't need to be answered. but she did answer why it changed, why she stopped using, and then she said she didn't really like it, so she just stopped when she stopped that lifestyle of waitressing. And these are the only 2 drugs that she identifies.
But you could continue if there were
Right.
more substance in the history. Again, there's the link at the bottom,
To add
to add drugs, and you just continue. Then we're going to go to the next page.
So this, again, because we're in dimension 1 of the ASAM dimensions, so we are trying to assess for any acute intoxication or withdrawal. So we want to know if she is currently intoxicated or currently in withdrawal. She has reported, if we remember from the last page, she does report that she hasn't used in a week. And sitting with her, she shows no evidence of any withdrawal symptoms. So is there any evidence of acute intoxication? No, she is not impaired at this time. Any intoxication management needed? We're saying no. If there was, if the client was showing signs that they had used that day, we do want to have some type of plan to help that client. Is there evidence of acute withdrawal? Is she showing any perspiring? Is she not feeling well? You can ask, if you're noticing that they look as if they may be uncomfortable, you can ask them, are you having any shakes? You could ask them to put their hands out and look for any evidence of it. And if they do, again, we want to have a plan to help them get to assistance if they're showing signs that they're in current withdrawal. Have you ever had problems with withdrawing from alcohol or drugs, any seizures or medical complications? She says yes. Always describe that. She says, I've had bad hangovers, nausea, vomiting, and sweating for a day or 2. So she does report that she does show withdrawal symptoms. So I can look at this and know that she probably has have tolerance and withdrawal, which is part of the evidence of her diagnosis. Have you ever overdosed? No. Is the client taking any medications to mask withdrawal? No. If they had said yes, we would want to, I think, would a box come up if they say yes? Yes. So if they say yes, then you want to list the medications. This may be that the client was given some type of sedative or Valium, and that would mask any signs of withdrawal. And we just want to make sure that we know that they're using medication to help them with withdrawal. Maybe they have their drug of choice was opioids, and so that they are on Suboxone. We need to know that they are taking Suboxone for withdrawal symptoms, and that would be documented here. The comments that we put was patient reports she felt some discomfort for 2 days last week after she did stop, but has been feeling well since, which is a pattern with her. She has a hangover for about 2 days, so she does have withdrawal symptoms, or had withdrawal symptoms. She reports her last use of alcohol or drugs was 1 week ago, and she has no current symptoms of withdrawal, so she's not in any type of withdrawal or detox. Oh, right. So at the end of each dimension that we're assessing, we're going to score right at the end of the dimension. We're going to identify if there were any concerns in this area. So are there any acute intoxication or withdrawal concerns? No, we don't have any with her. What's the evidence for them? And the reason why we don't have any concerns is her last use was 7 days ago. So she is past the potential for having acute withdrawal symptoms. So we're going to score her on a scale of 0 to 4, and she's at a 0 because she has no issues as far as withdrawal. If she had mild issues, or say she was withdrawing from opioids and was on Suboxone, then we would want to put mildly difficult because she is monitoring them and medicating them, but she is experiencing withdrawal symptoms. But this would not push her into any level of care that would have to address that because she's already addressing her withdrawal symptoms.
Right, and one of the things I just wanted to point out on all of these ASAM dimensions, the first question there is really just yes or no. I realize it's a text box. We're going to hopefully get that fixed soon, but you don't need to write any explanation in that top box. It is either yes or no, and then you would explain it in what question 2 was, what is the evidence for them.
Right. And just one more piece as far as withdrawal symptoms, for other drugs such as opioids. So if the client is experiencing withdrawal symptoms, but they're not in crisis, we do want to make sure that we can actively at that time give them referral sources to help them through the withdrawal. So you should always have MAT services available to know where to send them and where to help them. They may not be in a situation where they have to leave the assessment to go get them, but we need to make sure that we have that referral source for them before they leave us that day. It's very important. So at the bottom of every dimension is a box that has goals. We do want to identify a goal for each section. If there is no need for a goal in that section, you can put NA because she has no issues. We're obviously not going to have any goal in here. But the purpose of this is to start the process of your treatment plan. So this isn't going to populate into your treatment plan, but you're starting to create a treatment plan by identifying goals in each section. And again, this one doesn't have any due to her being at a 0. So when we click next, we're going to move into Dimension 2. Dimension 2 is our biomedical conditions and complications. So this is any health conditions or medical related symptoms or conditions that would interfere with their treatment or would interfere with their recovery process. So we're trying to identify any medical health conditions that we need to be aware of. So we're going to start with how do they rate their health. There's no scale here. My recommendation is to do poor, fair, good, or excellent. To do a scale from 1 to 10 is pretty broad. We really can't identify if someone says 5 out of 10 what that means. So I would use maybe just a 4 Likert scale to rate them. She puts fair. So she obviously feels that she has some health concerns. How important is it for you to see a doctor? Somewhat important. There is a scale there of not important, somewhat important, important, or very important. So she sees it somewhat important to see a doctor. Do you have any medical conditions, including a chronic condition, or do you have any physical complaints? And then it lists the type of medical conditions. So you have to answer each one. She does say no, but she does go to thyroid. She says yes. Describe hypothyroid with Hashimoto's, which is an autoimmune disease. She says no to the rest. She says yes to the autoimmune disorder, and she describes it as lupus. And then she says no to all the others. Again, use your comments box if you need to. If there's something that you need to further flush out or further describe, please put it in the comments box. And this is to help you because you are creating the picture and you are creating the diagnosis. We're going to continue on as far as, are there any medical conditions caused by your drug and alcohol use? She didn't answer these. I thought we did. Okay, so now we're on page 2. Are there any medical conditions caused by your drug or alcohol use? She says no. Do medical conditions make your drug and alcohol use worse? She says yes. My symptoms flare up when I have hangovers. So she, which we should add here, she tends to drink to help the pain. Does your alcohol or drug use make your medical conditions worse? And she said yes, she has more flare-ups due to the up and down of the drinking. Do you have any serious medical conditions when you've tried to stop? She says no. And do you currently take medications? She's currently on Synthroid for her hypothyroid. She has no allergies. She's not pregnant. She has a primary care doctor that she has seen 6 months ago.